approaches. As my slides are being brought up on the screen, I'd like to thank the organizing committee for giving me the opportunity to talk about this important subject. Psychosocial approaches are not among the subjects that we have a keen interest in as psychiatrists. My main intention in delivering this speech is to spike your curiosity about the subject. Now, the reason I'm seeking this outcome is as follows. Recently, I've been involved in a number of studies in substance-using adolescents in Ankara. Now, more frequently than psychiatrists, we have psychologists and social workers who are more actively involved in dealing with these children, especially with adolescents. Now, they have, of course, a word to say, an intervention to make, but since when we do not know about the field, we cannot come up with the relevant arguments to use with these professionals. That's the main intention of this presentation. Now, we're talking about a very wide field, very wide area. I'll briefly come up with a definition first and then give you some of the basics about this field. And of course, in a 15-minute presentation, it will not be that much possible to go into detail, but I'll, give you a number of hints, or rather point you in the right direction as to some further reading. When we look at substance abuse disorder, therapy interventions need to be continuous because this is chronic and it has huge costs from a social, medical, and economic point of view. In the United States, the estimation is about $400 billion per year. In substance abuse, psychosocial approaches have multidisciplinary interventions because we're not talking about a single group, as mentioned by previous speakers, especially the adolescent age group have very high levels of substance abuse, the usage of multiple substances simultaneously, and there are multiple risk factors as have been covered. And as Professor Aykut was saying, the medication that we have available to us is not that diverse, and the studies with this age group with the available medication is also very limited, so we don't have very powerful arms or weapons in this fight. Therefore, we need a multidisciplinary approach. The objective of psychosocial approaches is to change the behavior of the substance user through different means. Psychosocial treatment approaches are classified into two. When we focus on risk factors for the individual, and risk factors that are environmental and familial in nature. So this is similar to that. Behavioral approaches have to do with increasing the willingness of the individual and continuing that willingness to keep them from getting away from a treatment or stopping treatment. And family-oriented approaches on the right, they focus on, of course, risk factors such as substance abuse in the family, having low socioeconomic status families. These are risk factors, of course. And an adolescent with substance abuse disorder disrupts the family as well. And as a result, the family has to be there as part of the treatment. Motivation-increasing therapy is among the most frequently used with adolescents, and the reason is that adolescents alone rarely seek solutions to this problem. Their motivation to start treatment usually is based on the willingness of parents, the direction from their schools, or more recently this obligation of legal reporting. And most adolescents have low motivation when it comes to stopping the substance because as period of use is prolonged, the harm harms start to appear, and since adolescents have not had that much use in terms of the number of years, they're still enjoying it, as it were, and not seeing the harm, and therefore they refrain from accepting therapy as something that is necessary. And these therapies focus on rapid and inner motivation change. We also have cognitive behavioral therapies, or CBT therapies. We also have 12-step facilitating treatment, as we call it, especially used in adolescents and adults with alcoholism problem. There are approaches helping individuals get away from substance, rewarding systems in exchange for positive behavior, and there are also interventions to adolescents with societal factors. Let's have a look at motivation increasing therapies. Of course, we will not have the time to go into the detail of all of these, but I'll rather pick a few and give you the main features about those. Motivation increasing therapies aim at rapid and inner change, and it is not a guiding or training step-by-step approach. Instead of that, it tries to mobilize what the individual is capable of. It has 4 sessions which are structured and individualized, and individualization is very important at this point, because the motivation ensuring factor, the main factor, is to have an appropriate approach that would fit the features of the individual. The first 2 sessions are spent talking about the plans and the potential change and the motivation required for that, and the last 2 is about encouraging the patient and having the patient provide feedback about the potential changes. Motivation increasing therapies, or MIT therapies, have 5 key features. The first one is expressing empathy. The second one is determining contradictions. Refraining from the reality, or escaping from reality, is very common in substance abusers. Not allowing that and pulling the individual closer to reality will be very important, but of course in line with their personal motivation. So we're not talking about anything didactic at this point. The appropriate interventions to the development of resistance, that's also key. When we talk about resistance, we need to see it as more of an analytical concept, but we also have to have a focus on the features of the individual. Here we're talking about processes that might keep the individual away from treatment. That's what we mean by resistance. And one final, 5th component is also included. When it comes to motivational interviewing, this is a review of the literature you see on the screen. And as we have already expressed the low rates of success in treatment, this is very important. If motivational interviewing is used, 67% increase is achieved in participation, and recovery here is not a long-term recovery, but rather staying in treatment. That's the intended use of that expression. Now, important points are that 2/3 of these studies have shown that motivational interviewing reduces substance usage, and the 39 studies were reviewed in this review of the literature, but they had very small sample sizes, not more than 50 patients. Now, the method seems okay, but there are not detailed studies of the components that actually achieve the change in question. Now, one of the books I'm about to recommend, this is slightly old, from 1996. It's called Motivational Enhancement Therapy Manual, but it's still current. If you go into Google Academic, you will have access to the book. I do believe that it's a good resource, a good reference for motivation increasing therapies. CBT, cognitive behavioral therapies, have become really popular in recent years in child, adult, and adolescent psychiatry, because this treatment technique is more adapted and more suited to studies, trials, and therefore academic improvement. Standard CBT is a time-limited structured psychosocial approach, and it is the implementation of the social learning theory's cognitive model to substance abuse. According to this theory, drinking has to do with, for instance, the problems individual faces in his or her life. So CBT does not focus only on the behavior of drinking, but also towards the solution of these problems, defining unreal thoughts, coping with the development of negative mood, and preventing relapse are some of the objectives. It can be used as monotherapy or along with motivation-increasing therapies, and it has been demonstrated to have an effect to be successful in substance abuse in adolescents. The 12-step facilitating therapy is used for the most part with alcohol addicts. In this approach, the main principle is, for instance, encouraging participation to an AA meeting or an NA meeting, and the assumption here is that by sticking within this group, the substance abuse or relapse rates will go down. In the United States, it's the most frequent treatment method with adults. There are only a limited number of studies with adolescents. When dealing with alcohol withdrawal, for instance, this 12-step facilitating therapy is also recommended, of course, along with the participation to AA groups and the like. And adolescents can be motivated in this way to stick with the therapy rather than doing other interventions, and then the additional steps and stages can be, of course, thought about and planned, but there are still a very limited number of studies. You have 2 minutes left. Another book you can access on Google Academic. Family therapy approaches entail the following. Family-oriented therapy is the most studied type in this group. I'll talk about it. The family-oriented therapy, or FOT, is actually a technique that focuses on psychoeducation, about substance abuse disorder, helping the parents, and improving communication between members of the family, and achieving the participation of family members to treatment and or support programs. Although the number of studies is still not huge, this is the particular method that's been studied the most. This is a meta-analysis of the methods I've described a couple of slides back. The most important point here is that they do not have that great differences. They are not really superior one to another, but they are all effective under certain circumstances. This is a study which compares family therapy and CBT. It says that both are effective, but family therapy is longer lasting. And this is a general assessment study, in my opinion, or we can consider it as such. And you can have a look at it because I found it very useful while preparing this presentation. Now, one final point I'll make is that it's not only about psychosocial therapies that will be the most effective, nor pharmacological approach on its own. You have to have a holistic approach. You have to have an individually tailored treatment, unless you will not be able to work with substance abusers, and I would like to thank you for your attention.
Peki, herkes